Good afternoon. Welcome. For those of you who have not met me, I am Christine Rice. I'm the Client Relations Manager here in our Innovation Performance Department under Chief Lamb. We do have an ongoing speaking series, and we hope that you will get an opportunity to attend all of them. We promise the topics will be interesting. So today, as part of our information awareness, our topics are going to be being a consumer in an EMR world. And EMR, for those of you folks who aren't familiar, is the electronic medical records. We have with us today two guest speakers, Sharon DeRohi, who is the Chief Information Officer for the Children's Institute here in the city of Pittsburgh, and Angela Hornman, who is part of the CERT program at Carnegie Mellon University, which is the Software Institute, and she's going to talk to us a little bit today about employee security. So without further ado, I'll introduce our speakers, and Sharon, welcome. And
thank you.
Can't wait to meet you.
Thank you very much.
Thank you so much for inviting me. I'm excited. I'm always excited to actually do these kind of talks. And the one thing I'll set the stage with is, I know when Christine contacted me, she said it was about awareness. And she had a whole bunch of things like that she wanted me to talk about. And I said, how many minutes do I actually have? So I kind of jam-packed a bunch of stuff in this slide presentation. And obviously we share the stage with the CERT folks. So I'm hoping to broaden your awareness, and if there are any questions, I'd be happy to spin off, and I really could probably spend an hour on any one of these topics. But I kind of framed it because there's so much talk, especially in our healthcare world right now, of electronic medical records and the technology that goes behind it. So I hope you walk away with an awareness so that the next time you go to your family practice physician, for instance, you have a little better understanding of some of the things that might be happening behind the scenes in his or her office, and what may be in store for us as consumers, and how you really can get involved as a consumer. I always like to start off with a little bit about myself. I've been with the Children's Institute for 20 years. I'm the Chief Information Officer there. That's how I met Christine. She actually worked for me several years ago, was a fantastic employee. We're located in Squirrel Hill, and we specialize in pediatrics, and on the rehab side, we have 62 inpatient beds. We have several outpatient locations that you may have heard from. But we also have two other specialty areas, our day school, which serves approximately 190 students. And we have a component that we call Project STAR, and it really focuses on family placement, preservation, adoption, all around kids with special needs. So hopefully if you have a chance to look us up, or if you're in the neighborhood, please stop in, and we'd love to give you a tour. We're relatively small, about 550 employees. But in terms of the talk here, what I want to instill with you is, even though we're small and we might be specialized, we actually entered the electronic world more than 10 years ago. Back in 2002, we actually engaged in a project that put us on the map for an electronic medical record, which really at that time, a lot of the focus was on physician order entry and not necessarily the documentation. So our board was very forward thinking in terms of keeping us ahead of the game, and I'm happy to say that really has allowed us to be where we are today in terms of the back end side. So again, kind of focusing on raising awareness. Some things to consider whenever we're in the consumer world. You may have seen some of these acronyms or even heard some of these words, and you might be thinking, how do they actually apply to me as the consumer? I'm going to focus in on the ones that I have highlighted in yellow, the whole concept of what is this thing that people are calling EMR or EHR, and is there really a difference? You might have heard the phrase meaningful use. That came into play really around 2009. And then more and more we're starting to hear about HIE or HIO. What's that all about? And that really does have a profound effect on us as consumers. So hopefully at the end you'll be interested enough that you're going to even take a part as being a stakeholder here in Pennsylvania. And then a couple offshoots that have really helped along the way, especially here in Pennsylvania. There's a local professional society known as HIMSS that really has a lot of the underpinnings of what we've been doing from a healthcare technology perspective. But probably most importantly, as us as Pennsylvania taxpayers, there's actually a partnership authority now that is run under the leadership of the governor that is really making strides for healthcare, especially in the exchange part across the state, which is really exciting. So I'm going to kind of bebop right through some of these things, and again, trying to jam pack a few things right into this presentation. You may have heard EMR versus EHR. And I just want to set the record straight. It's okay to use them interchangeably, but underlying, there really is a difference. EMR came first, and it really focused in on plainly digitizing the medical chart. So all that paper stuff that a doctor was doing, whenever we became into the electronic world and started thinking about that, EMR really focused on those individual physician practices or internal to a hospital. That's how the EMR was actually born. We've really broadened that scope now to really entertain electronic health record. And really that, whenever I say broaden, I mean outside the scope of our individual practices in terms of physicians, but now engaging specialists, labs, other organizations, even through the continuum. We have the ability now to have information from a pediatric perspective, through adulthood, clear to senior living. So when you think about that and you think about some of the things that even as consumers that we're kind of recording and watching in our own healthcare, that's what's really involved or encompassing when one speaks of the electronic health record. But again, fine to use them interchangeably, but a little bit different there. Want to touch on, well, what really started the whole EMR conversation, and it really goes back clear, believe it or not, to 2004-ish, is where we really heard it publicly spoken of first, and that was during President Bush's reign in office. He was the one that created, under his reign, the Office of the National Coordinator of Health Information Technology. And I can remember being at one of the HIMSS conferences when his wife was there, and this was the introduction first of smartphones, and whenever she was actually communicating with her physician with that technology. So it got a little bit of headway in 2004, but through the years, really in 2009, you'll hear people talk about the HITECH Act, or ARRA. That's when it really, the fire got lit under healthcare organizations to really participate in not only just digitizing their own medical information, but really participating in the sharing of information. And the reason I say it lit the fire, because this whole concept called meaningful use, really from a regulatory perspective, allowed monies to be kind of doled out to states to actually get that fire lit and to engage physicians to invest money and also help them from an incentive perspective foot the bill for that investment. Because again, EHR technology or EMR technology is not cheap. It changes the way some folks do business, but it also, I mean, just like we know of in our own office settings, I mean, different people have different amounts of money that we can spend on the latest and greatest technology, or even phone systems for that matter. But meaningful use allowed that incentive dollar idea to really have the EMR initiative really take off. So you're going to hear about that, and you may hear about that even in the news, but we can actually kind of focus back in on that. I think was one of the primary driving forces in the EMR adoption world. These other things that I have up on the board, whenever people were talking about HITECH, or through the years when they started talking about digitizing or EMR technology, it was really about healthcare reform and healthcare change, thinking that maybe if we could get our act together in terms of all this paper pushing that we were doing, could technology play a role in somehow increasing quality and lowering the cost of healthcare? I'm here to say I don't know that we can necessarily say that today, but I think we're on the path. Even if we think about our own health care, hopefully it won't be long that we still have to carry around all our medication lists. We'll be able to actually have that shared amongst healthcare organizations. So I think we're on the right path. Still a little bit of work to do in terms of really seeing the outcomes there. I put this slide in the presentation because in the EMR adoption world, and in our organization in particular, we took on, not only because of the HITECH and because of the interest in organizationally digitizing our records, but also HIMSS Level 7. You might hear people talk about that. They were the first ones that really came up with a kind of almost a pyramid kind of look to enforce or have folks start to take a look at how much are we electronic. And you know how people like competition. So healthcare organizations aren't any different from that. So the kind of the race to get them to be the most digitized was really something that was born out of the HIMSS group and their level 1 through 7 kind of pyramid, with level 7 being paperless. So everybody was striving for, as soon as they hear EMR, let's go paperless. That's not always what it turned out to be, but that was another driving force in terms of EMR adoption. And again, meaningful use. Those things actually at the individual acute care level or the hospital level were also combined with internal goals like productivity. Can we improve the productivity of our clinicians? Can we improve patient safety? Could we improve compliance from a billing perspective and a documentation perspective? So those were some of the things that actually drove our EMR projects along the way, and I thought it was important to share with you, because when you go to that physician office, some of those times when the signs are up, conversion in place, or we're learning a new system, these are the things that are happening behind the scenes. One of the things that our societies that I mentioned was HIMSS. I throw that up there again just because we throw around acronyms a lot in IT. That actually stands for Health Information Management System Society. And again, it's people interested in healthcare information technology. So it's not just EMR, because they started way back in management engineering days when they were starting to look at, well, how long did someone wait in the waiting room, and maybe do analytical studies on how could we improve that kind of focus. And they've gotten more recently into obviously EMR and health information exchange. So that's an important piece. But most importantly, in terms of us speaking about EMR adoption and where we're at from a consumer perspective, they really led the way from a society perspective with that pyramid approach and striving to have people get to that level 7 where it was paperless. Just a couple slides about the meaningful use regulation. Again, I mentioned it. It really came into light around 2009 with the HITECH Act. And meaningful use is really around not only the technology, but a set of standards that would incentivize folks to adopt EMR technology. So if I had to put it in words, I best said it using the definition that ONC even had out on the website. Using certified EMR technology, hopefully, was to improve the quality, safety, efficiency, and reduce health disparities, engage patients and families. If you remembered, it hasn't been too long that we've actually had these things called portals, where you can actually go online and schedule an appointment or look up your lab results. Again, really, this EMR technology and what came out of the HITECH really lit the fire for organizations to engage in those kind of portals to be available. Improving care coordination and population and public health, we're really probably at, if I had to say, at the tip of the iceberg. There's so much data, and you'll hear people talk about big data. We're hoping that all of the collection of data that folks are gathering is going to hopefully lead us down the path of improving population health, or at least being able to analyze that population health perspective. And then obviously the maintaining of privacy and security at the very start of this, and the start people will probably be able to speak to it even better. This is something that is always very sensitive. Myself, look at the news whenever we talk about the breaches that happen on the credit card side or the Social Security number side. In healthcare, our health records, believe it or not, are even more valuable in some neck of the woods. So if we did not have standards and weren't able to maintain the privacy and security of those, none of this would be attractive to any of us as consumers or as technologists. So that was another underpinning of, under the meaningful use standards, to come up with standard ways that we could safely transmit and store PHI, or public health information or patient health information. The reason I'm going to show you these next two slides, sometimes when we're engaged with our physician, they've started to use computers in the exam rooms, and you may be asking, how come they're asking specific questions? They didn't delve into all of this, or they were talking about discrete data that needed to be collected now that we're in this EMR world. And in particular, under meaningful use, in order to get incentivized, and what I mean by that is literally they are getting money to actually spend on being able to foot the bill for the implementation of that EMR. So they needed to actually put in the regulation, what could we prove back to the government and the folks that wrote the regulation in order to get the money that we were really meaningfully using the system. So things like the CPOE, physician order entry, that stands for, or recording all of the information up front related to our demographics. You'll see some things here. Your physician might have started to provide you or allowed you an electronic copy of your discharge instructions. Again, that wasn't something that was on the table before high tech and before meaningful use, but in order to be incentivized now, some of these things were being adopted by healthcare organizations because they wanted to show that they were doing that with their EMR. So you might have seen some of these kinds of changes over the last couple of years because of those incentive dollars. Again, they're not going to say that out loud, but behind the scenes, this is what's happening. There were also optional things that, depending on where an organization is with their technology, it wasn't a requirement that we fulfill all of these. But again, you may see incorporating lab test results into EMRs, for instance. That's what allowed us, from a portal perspective, to actually have the consumer be able to view their lab results. Prior to this, they might not have been collected what we call discreetly. They might have just been enclosed in the verbiage that the doctor dictated on the discharge summary. A little more difficult to pull that information out to actually get a particular reading or a particular lab result. Meaningful use at least set the stage for saying, no, that information needs to be stored discreetly in the electronic health record. The other thing that came along with meaningful use is everybody recognized that all of this can't happen at one time. So they came up with stages. So the final document relating to stage 1 meaningful use standards that had to be adhered to really was published in 2010, and the focus there was really adopting EMR. So if people didn't have it, they were doing system selections, they were engaging consultants to help them select that and actually implement that. Stage 2, which is what we're in currently right now, the actual regulation and the document behind the Stage 2 initiatives really was published in 2012. It focuses more on that clinical decision support, engaging the families and the patients. And again, we're in that midst right now. And Stage 3 is still in the talking stages. A lot of formation being put together by a lot of people soliciting feedback as to what we can actually do in Stage 2 or require healthcare facilities to do in Stage 3. The final published date for that is expected to be around 2016 and possibly into 2017. The focus in that stage is going to be more on the sharing of information. This HIE then leads me to my next set of acronyms. You may hear people starting to talk about HIE or HIO. Health Information Exchange is what HIE stands for, HIO, Health Information Organization. They're being used interchangeably. It is simply taking that electronic information now that we've digitized and allowing that electronic movement of health-related information among organizations. So now it's just not about sharing within a hospital integrated delivery network that might have multiple hospitals. Now it's talking about us over here in Western Pennsylvania maybe sharing information with hospitals in Philadelphia. So if I'm traveling, for instance, it's again something that can be looked up in their hospital relative to my care here over in Pittsburgh. The couple things that are really exciting about the HIO is because we live here in Western Pennsylvania, we are very fortunate, not only because we're in Pennsylvania, but Western Pennsylvania has seen a lot of activity and a lot of interest in terms of HIO and HIE. In particular, Pennsylvania, in 2012, there was a Senate bill that allowed the Partnership Authority to be enacted. And its mission is really to improve healthcare delivery and healthcare outcomes in Pennsylvania by enabling the secure exchange of health information. So what does that really mean? That basically means that this authority is responsible for the electronic highway that is being built here in Pennsylvania to allow us to actually share information across the state. And the way that's happening is, I want to go back to this screen here. In Western Pennsylvania, we have a healthcare information organization called Clinical Connect. We also have another health information exchange starting on the Highmark and Allegheny Health Network side called Tapestry. And this organization or this exchange is allowing organizations that have made the investment in electronic medical record technology to actually now share that information with other organizations. So, for instance, your family practice physician may already be engaged in this. So if you're signing the privacy notice, read some of the little finer print. You'll see that you might be signing to say, yes, it's okay for me to have my information shared with the HIO or the HIE. That's a list on the left-hand side of healthcare systems, for instance, that are engaged in the Clinical Connect piece. So Armstrong County, Butler Health System, Excella, Heritage Valley, St. Clair, UPMC, Washington, all on the healthcare system side. But notice here in the picture, there are also independent practice plans engaged. So if you take your kids to the Pediatric Alliance, they're sharing information with the exchange. We happen to be one of the folks in, sharing information on the rehab side. And then post-acute care, the Pennsylvania or the Presby Senior Care Organization is also engaged with this sharing. So hopefully you can see then what's happening. Not only is the information being made available to you in the patient portal, but now as you move through the continuum of care, you don't have to be like my dad and carry the medications and the surgeries in his back pocket to actually remember when his surgeries were or what medications he's in. This HIE here in Western Pennsylvania is actually going to be fed into the state highway that I spoke of. And I want to just throw up a picture here for a minute before I describe some of the history. When we talk about the Pennsylvania eHealth Partnership Authority, this is the diagram or the schematic that ultimately is what's contained in their mission. And in particular, whenever I'm speaking about the HIOs or the Health Information Exchange, it's this leg here of the diagram. So the idea here is how can we combine all of the information that has already been digitized across the state, but allow the exchange of information across the state. So the backbone that is actually happening in this diagram, they're calling it P3N. It's the patient and provider network, the Pennsylvania Patient and Provider Network, being able to actually know and be the keeper of if somebody is sitting on their EMR side and they want to actually see what the care was like for the particular patient that I'm actually serving here, you can click on a link. It'll be able to go out to that highway, pull in that medical record information from wherever that patient may have been if that patient elected to participate in the exchange. So if you said no to that, your information isn't going to be available. But if you said yes, that means your provider there now doesn't have to have you ask for, can you bring along your medical records, a copy of your medical records? That was the olden day. We all went, if we had a specialist, we had to gather all that information before we went to the specialist. Now with the network, we'll actually be able to do that electronically. The exciting piece is, on the Pennsylvania front, this has actually been going on for several years. So even though the high-tech dollars brought forth the monies from an incentive perspective, back under Governor Rendell in 2003, he actually started the Governor's Office of Healthcare Reform, and they laid out the roadmap for this highway. Governor Corbett picked up on that, and that's when the eHealth Collaborative Office was established in 2011, which ultimately led to this Senate bill in 2012 to establish the formal partnership. The one other organization I have up on the screen here, the PA eHealth Initiative, I was heavily involved in that organization. We're a little bit silent right now because the partnership is really, we're all putting our ducks into helping support the partnership piece. But this PA eHealth Initiative organization was really a group, it was a nonprofit group of interested people that said, hey, we're doing a lot of stuff electronically. Can't we get the ball rolling in terms of exchanging information or making sure that the physicians have the resources to install and implement electronic medical records? So all of this speaks to the fact that I think we live in a really good state, and we live really in a really good part of the state in terms of the interest and the support for these kinds of initiatives. This part here that I spoke of in terms of the HIO piece of it, I think the really exciting piece is it's not just talk. This is the year that it's actually coming to fruition, that the highway itself is becoming actually live. So by December 2015, early January 2016, several health information exchange organizations across the state, Clinical Connect being one of them, But also on the eastern side, there's another health information exchange called Health Share Exchange of Southeastern PA. St. Luke's is also on the eastern side. Tapestry here also in western Pennsylvania. Keyhigh is really kind of think of that as the middle of the state around the Geisinger area. They have an information exchange. All of these folks have committed to actually contributing and participating in the state highway. So it won't be long. It'll be in our lifetime that we really will be able to see if we're traveling over on the East Coast side and we happen to need care in a Philadelphia hospital, those emergency room doctors may be able to pull our information here from the western side of the state. So that is really super exciting when you think about all of the stuff that's been happening independently and in our lifetime being able to ultimately say, hey, I remember when that was just talk and it's really coming to fruition. So I tried to dram a whole bunch of stuff from an awareness perspective, but hopefully you've walked away with a couple little things related to EMR, EHR. Maybe meaningful use has a different meaning for you now. What the PAE Health Partnership Authority is all about. The fact that the HIMSS group, from a society perspective, if you're into IT and you want to get more involved with that, there's a professional society that actually lends itself to that. And probably most importantly, the movement of the HIE and the HIO activities in our state. So you may be asking, so how can I get involved, or can I even get involved? Being a healthcare consumer in Pennsylvania, and specifically here in Pittsburgh, I would challenge all of you, if you're interested. There are several good websites to actually go to in Pennsylvania. The Authority website, this paehealth.org, has a great website, a lot of good information, and I would actually encourage you and challenge you. There's even there's a link on the left-hand side that says stakeholder. As taxpayers here in Pennsylvania, I encourage you, take a look at that, become a stakeholder. It'll actually put you on the path of at least seeing the information and being able to contribute. If you have an opinion about where healthcare is going in Pennsylvania, in particular with all of the exchange information, this organization is looking for consumers to become more involved. So don't look at this as, well, this is some IT thing and only if I'm involved in healthcare or EMR. We're talking about, we're all tax-paying citizens. Let's get involved. In Western Pennsylvania, the HIMSS organization has a Western Pennsylvania chapter. I encourage you, if you're looking down that pike, you could get involved from that perspective. And in Pittsburgh, I put this up there because our organization is involved in Clinical Connect. Soon we'll probably be hearing more about Tapestry and where the other HIE might be going here in Pittsburgh as well. But Clinical Connect, right now, you may be even involved if you have some of the physicians involved in any one of those organizations. You might want to just check that out to see the information and how they put that together on the website. Really very well done. I don't know if you want to entertain questions beginning or end. Any questions?
Are there any initial questions?
Sure.
Yeah, wow, okay, there you go.
I'm assuming that that
Microphone.
every state is involved with their own organization. Is there a federal organization?
Actually, that's a really good point. And actually, Pennsylvania is a little bit behind. There are some states that are actually way ahead of us in terms of the health information exchange. It really had to do with where their state and where their government and where organizations within the state wanted to be involved with that. But at the federal level, outside of the meaningful use dollars piece really kind of lighting the fire, there is a health information exchange called Healthy Way. And actually, back on this one slide, whenever I talked about the where Pennsylvania was actually going, I didn't really allude to it, but up on the top here, the intention is at the state level to actually connect to that interstate exchange, and that's through the Healthy Way. It used to be called the National, the New Win, but now it's called Healthy Way. So that would be what you're speaking of. So again, if we travel to California, then will our California doctors know about our stuff in Pennsylvania? Don't have the exact date as to when that's going to get connected. Probably sometime after that 2016, because right now they're concentrating on Pennsylvania Health Information Exchange connections. Starting to talk a little bit to Delaware, West Virginia, and Ohio, but not necessarily at that national level. Now, Clinical Connect, the one thing I will say is kind of dipping their toe into that water already because of our big veteran population. Part of Healthy Way also includes the Veterans Administration. So Clinical Connect is actually already taking that step to become connected. So yeah, exciting time across the nation. Other questions?
Yes, this is an opt-in,
State.
right.
Yes.
So therefore, you have to sign the paper before your medical records are on this highway.
Actually, that's the correct terminology, but it's just the opposite. If you don't want it to be shared, you have to sign. So be careful when you're looking at that, because again, different people have different levels of sensitivity about whether or not they want their information shared. The one thing I didn't actually dwell on, psychiatric information is not being shared. So, but medical information is really the crux of what we're doing right now.
So my additional question is therefore, if you, it's an opt-out situation, if you decide to opt out, how do they purge your records?
Actually, it's a matter of turning on a switch. Because what ultimately ends up happening is at some point in the future, you may decide, you know what, I really am comfortable with this, and now I actually want it to be turned on. So when they flip that switch, they'll be able to see all of that. So when you flip the switch off, nothing gets seen until you actually say, yes, I want it to be shared. And then all of that history then becomes available. So it doesn't start necessarily at that point in time. But it does have to do with when your different providers were participating. So if they weren't participating yet, that stuff that was paper might not be available.
So given these the guidelines for the EMR, is there a system that's ensuring some sort of compatibility between different systems?
You're talking about EMR systems themselves?
Yeah, so that data provided in one lab or one hospital will be accessible and usable easily in another place, or is it just kind of each person does their own system the way that they want it?
That's actually a really good question. When EMRs first started, it was kind of what you just described. Every vendor was out there trying to think about functionality and think about that just in the confines of the one physician practice or the one hospital. Since then, there are standards. There are national standards now from a technology perspective. And to even participate in meaningful use, your EMR has to be certified. So there's actually a body that certifies your EMR. So you know, as an organization, when you're making that purchase, you will be compatible. And then interfacing becomes a different issue. There's a different set of standards, HL7 standards, that are in place to allow, if we're transmitting lab information, that lab information is transmitted the same way, or admission information or discharge information. There are national standards for that as well. That's a really good question.
All right. Thank you.
Thank you.
I'm Angela Horniman. I'm from CERT, part of the Software Engineering Institute at Carnegie Mellon. I was asked to provide a general security presentation, just to go over some, as a reminder, and in case you don't know, some of the general security practices that can help safeguard your information and both your home and your business. Some of the topics I'm going to go over are: password reuse is a no-no, passwords are keys, be careful with your emails, and social engineering is one of the most prevalent ways to lose your personal information, such as credit cards, or to get your computers and networks infected. So starting out with passwords, password reuse is a no-no. Why? Is this true or false? If someone can access your email account, they can access some financial account. Any guesses?
False.
Not for 45% of you. So many people reuse their passwords between accounts that if one account, whether it's an email account or a social media account, is compromised, attackers can guess at your banks and use the same password and login information to access those accounts. I put together some scenarios. These particular scenarios themselves are not real, but they all have elements that I have pulled from different attacks that I've read about. Even if you would do something like use a different password for your bank account, if an attacker can get into your email account because you use the same password for your email account, or the email account password account itself was compromised, attackers can get into your bank account information. Why? Because of the password reset thing that are usually tied back to your email account. We've seen instances where there have been attacks. For instance, a customer loyalty database has been compromised. Those databases, when you sign up for a card like a Giant Eagle Advantage card or Rite Aid Wellness Plus program, have your name, email addresses, often security question answers. Sometimes they even have the passwords that have not been encrypted stored directly on the database. If an attacker can see this information and you've reused your password anywhere else, there's a good possibility that they will be able to use that information to get into some other account. If one of those accounts happens to be your email account, well, then they can do password resets on any other account that they would be interested in. If you write down your password and leave it in a drawer, passwords are keys. They provide information not only onto your computer, but different accounts. I have seen all these happen either personally or in some of the attacks that I've read about. In a previous life, I worked in an IT department. We were supposed to lock our computer screens anytime we moved away from our desk. Well, one day somebody walked away from their computer. It wasn't me, and I did not do this. But one of my coworkers decided they were going to turn the desktop upside down and change the handedness of the mouse. That took him a while to fix, because trying to use the wrong direction mouse upside down is hard. There have been instances where somebody has left a password lying around or their computer unlocked, and somebody else has come in, they've been malicious, they don't like the person, or they've just been bored and they've decided to use the computer. If somebody has a vendetta against you, maybe they're going to do something with your account that you don't like and is going to get you into trouble. A little later on, I'll talk about how a malevolent spy can actually get to your desk in the first place, which can happen. That's one way to exfiltrate data. And how many have something like the Nest app, where it takes care of your home temperature remotely? Or you have a baby monitor that's connected to the web. If you leave your password laying around, or you have accounts unlocked, or they're poorly protected, and somebody can get into your laptop, desktop, computer, or smartphone, what else can they manipulate? Not just the data on your computer, but maybe even data in physical systems within your house. Emails are the most common way that attackers get access to account information, access to network data, or data that they shouldn't have. One of the reasons is that even if people have virus scanners don't detect everything. Sometimes the email itself doesn't even have a virus or something that would infect your computer. It's just the email can convince you to do something that gets you infected. Virus scanners help take care of the most prevalent forms of malware that get on your computer. It doesn't help take care of all of it. One thing that we have been seeing a lot of, especially in the government space, is that emails are crafted to look like they come from coworkers or conferences or vendors that you legitimately work with. These emails will contain attachments or external links that will cause something to be downloaded onto your computer that may do something like log everything you type or call back out to some website that will give an attacker remote access to your computer. I myself presented at a conference a few weeks ago. For some reason, all the vendors got everybody's email address. A few weeks after the conference, got an email from a vendor about a product that had an attachment and a link. I didn't click on it, I didn't open it, because that is one of the ways that a lot of the APT actors, the Advanced Persistent Threat actors, have been able to get into people's networks. They've acted as vendors or clients that you've talked to at a conference, and they've sent you they send emails. You either click on an attachment, go visit a website that they suggest, and then you're infected. Something that the more general population might see would be not necessarily something that's infecting their computer, but something that's encrypting with like CryptoLocker. And does this really happen? Yes. If you Google spear phishing examples, you'll see examples not only of the CryptoLocker or the conference, but so many more that some of them are funny, but a lot of them are really scary about how good these people actually are when it comes to constructing these emails. What's social engineering? Social engineering is manipulating social conventions, people's goodwill to facilitate some malicious behavior or to get you to act in a way beneficial to someone else. From a security perspective, what can social engineering look like? Any ideas?
All of the above.
Yes, all of the above again. I just talked about the email from a vendor. There was one instance that I read about, and this really hit me how good these people are when they want to do social engineering. Somebody had compromised either a webmail site. They were sending an email spoofing the address so it looked like it came from one of the victim's colleagues. The victim read the email, was sort of weary about what it said, wasn't sure, so he hit reply to ask, is this a legitimate email, thinking it would go back to his colleague. Well, it didn't exactly go back to his colleague, it went back to the attacker, who responded, of course it's legitimate. So the victim clicked on the attachment, opened it up, and was infected. Unfortunately, the victim didn't actually know he was infected, so there was a period of time where exfiltration of data from his organization was occurring from it, because eventually they found out that this is what had happened. If you have emails that you're unsure of or that you get with attachments that you're not expecting, what are some of the things you can do to verify? Exactly, yes.
Retype the email yourself and send it out, so you know you're getting to the right person.
Yes, both of those things are very good. The phone call would be my first choice, because you do have the possibility that somebody may have actually compromised the actual email account, in which case, even if you type it, it's still going to go back to an account that's controlled by the attacker. And there have been a few instances of that, though that's still not very common, thankfully. But you could do a phone call, or if you have something like a chat within your business, Skype or LinkedIn or whatever, that would be another option. Just as people can spoof email addresses, people can spoof phone numbers. So especially now when you have the phones like the Cisco phones where you're voice over our internet instead of voice over telephone line, you may be getting a call that has somebody's name in caller ID where it's not really from that name or number. There have been instances where some social engineering attacks have occurred where they've spoofed an organization's IT department's number. They call a potential victim. It's not too hard to find who works out for different organizations. I'm sure some of your names and addresses are on the city website. Call the number, have the number spoofed as the IT department, say something is the matter with your computer, I need your credentials to fix it. Don't ever give your credentials to anybody who asks for them, especially IT, because IT shouldn't need them. If they can reset your password, they shouldn't be asking for your password. If they actually need you to log in, they should be coming to you or asking you to come to them. This is one case where if they call you, you're suspicious, you don't recognize the voice as well as the number, tell them you'll call them back and then use your official number, because even if you, in this case, you can't actually control the phone number even if you can spoof it. Back when I was an undergrad, there was a lot of talk about social engineering with mail. People would compromise, your physical mailbox, go take out letters that you might be sending back to the IRS, or maybe stealing credit card applications to steal your identity. That leveled off for a few years, but in the past few months, I've seen an increase in talking about this again. In this case, you may be getting letters from the IRS or some other organization perceived to have authority requesting information. So you respond to it, and then people take the response out of your mailbox. Two things here. One, make sure if you get anything requesting personal information from someplace legitimate, make sure that you verify that the address or phone number that you're responding to that was listed in the letter is the actual one. So don't respond to what is sent in the letter. Go to the website and make sure that that's really. Also, don't send your mail back through your own mailbox. Take it to the post office. That way nobody can actually open up your mailbox and take out the response. Again, back when I was an undergrad in early 2000s, this was a big thing. People putting flash drives that contained malware out in a parking lot. People would randomly pick it up, not know where it is. Oh, it's a flash drive, free flash drive. Don't know who it is, so I can use it. Plug it in, you're infected with a virus. This still happens. Don't ever insert any random USB device, or actually anything, whether it's a flash drive, even certain things that you wouldn't think have memory, do have memory, so maybe a keyboard, a mouse. Be very leery, anything that you can plug into your computer, or CD drives or DVDs. If you don't know where it came from, you'd probably be better off not just tossing in the garbage. And the last thing I'm going to talk about is entering secure buildings. Here you have the guards at the door. Where we work at CERT, we have guards at the door. I was reading recently about a journalist who wanted to see if he could get, how easy it would be to get access to, I think it was some sort of secure city building, but I'm not sure. I don't remember the specifics. So he randomly chose an employee, struck up a conversation, and just walked in the door, following him. The people at the guard desk thought that, oh, this is a legitimate employee, I know who it is. They're talking, he must be with him. Left him the journalist left him at the stairs, went on his way. The same way, got into an extra secure floor. Was able to walk around for quite a while. He wasn't actually discovered. Don't allow piggyback tailgating when you're going into secure buildings. This would be one way where back here where I said the malevolent spy reads your email if they find your password because you posted it on a Post-it note on your monitor. That can be one way that they actually got into the building. So that's what I had. That's what I wanted to present.